This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna, where our discussion continues now with Dr. Bruno Daniele, who's the Director of the Department of Oncology and Medical Oncology at the Rummo Hospital in Benevento, Italy. Welcome.
Thank you.
So, Dr. Daniele, could you please begin with just a little basic overview of what is liver cancer?
Well, primary liver cancer is the 7th most common cancer worldwide, and it's the 3rd most common cause of cancer-related death worldwide. So it's a global health burden, extremely important, and it's basically related to some liver disease, especially viral hepatitis, both hepatitis B and hepatitis C, and most often it arises in a cirrhotic liver, which means that patients are affected by a various degree of liver dysfunction, which is extremely important when it comes to treatment, because sometimes patients have a poor liver function that prevents them to receive any type of treatments. Basically, liver cancer can be distinguished in early, intermediate, and advanced. Early is small liver cancers arising in a liver, well-functioning liver, and generally these types of patients can be treated with potentially curative treatments such as liver transplantation or liver resection or percutaneous ablation procedures. The intermediate stage is when the cancer is still limited to the liver, but it has been expanded within the liver to a degree that cannot be removed completely, and therefore palliative treatments are possible, most commonly chemoembolization, which means introducing through the artery, hepatic artery, some types of embolizing agents, small particles bound to drugs. Or alternatively, small particles bound to isotope that kill the cells by a radioactive emission. When it comes to advanced stage, so far we have only one drug which has demonstrated to improve survival of patients with metastatic disease or with portal vein invasion, and this drug is sorafenib. But at this ESMO meeting, some good news have been presented.
I have a curious question. Because the liver is an organ that's capable of rejuvenating itself, if you resect a portion of a liver that is has carcinoma, when it grows back, will the new growth be healthy?
Well, it depends. If the resection is made in a normal liver, yes, the new liver, the new growth will be the growth of a normal liver. But since, as I said, the vast majority of patients with hepatocellular carcinoma have a cirrhotic liver, the ability of cirrhotic liver to grow is much more reduced comparing to a normal liver. And again, it will not be a normal liver, but a cirrhotic liver.
What does one need to know if they test positive for hepatitis C? How do they monitor their lives?
Hepatitis C, we do not have a vaccine. We have antiviral treatments. Historically, we have interferon plus ribavirin. However, recently some new antiviral agents have been tested and demonstrated to be effective. So it is important to cure hepatitis C, and it is also important to follow the patients with hepatitis C and advanced liver fibrosis or cirrhosis to detect small hepatocellular carcinoma early when it is possible to do curative treatments.
An analysis to find out if you are a hepatitis C or B carrier is via a blood test?
Yes, it is a blood test. You check for the antibodies against the hepatitis C virus, and you can also check the RNA level in the blood, indicating what's the viremia in the individual patient.
Are there any genetic or familial associations to liver cancer?
No, actually, there aren't. There are some familial clusters of liver cancer, but they are linked to the familial clusters of HBV or HCV infection generally.
Is liver cancer considered a very painful disease?
No, it's not. Pain is not typical of primary liver cancer.
How do patients know that they might have liver cancer? Obviously, if a patient sees that they're looking jaundice, yellow, they're going to go to their doctor. But are there signs that one can look for?
If you want to detect a liver cancer in the early stage, you must screen the patients at risk, which means screening patients with chronic hepatitis B infection, patients with hepatitis C infection and liver cirrhosis, and generally all patients known to have liver cirrhosis. And to screen, the easiest thing is to do a liver ultrasound every 6 months.
Thank you, Dr. Bruno Daniele, Director of the Department of Oncology and Medical Oncology at the Rummo Hospital in Benevento, Italy. Thank you for teaching us something about a disease that probably needs more awareness amongst the general public.
Okay, thank you.